we hope monthly. I'm never ready for the this meeting will be recorded announcement. Again, welcome. Thanks for joining the meeting. We're here to provide our monthly updates. We have a number of new folks joining us as panelists, so I would like to go around and do quick introductions. I will pivot to Debbie Davis as my colleague here at OASAS. Give her a moment.
Hello, everyone. Welcome. I'm Deborah Davis, and I am the Associate Commissioner for the Division of Fiscal Administration here at OASAS.
And actually, I apologize. We do have two project management staff on. You don't have your cameras on, so I'm not like seeing your faces. If you'd like to please introduce yourselves. Lucia?
Hi, my name is Lucia. I'm the project director for the opioid settlement funds.
Hi everyone, Celine, and I'm a project coordinator for the opioid settlement funds with OASAS.
Great. And Joanne, I'll pass it to you.
All right. So hi, good afternoon, everyone. I am Joanne Morin. I am the acting executive deputy commissioner for the Department of Health, and I'm glad to join you. I'm joined by my colleagues today, who I'll ask them to also briefly introduce themselves. Let's start with Tina.
Hi, good afternoon, everyone. I'm Tina Kim. I am the acting deputy commissioner for the Office of Health Equity and Human Rights here in the Department of Health. Val?
Great. Yeah.
Hi, it's Valerie White. I'm the Deputy Director at the AIDS Institute.
Hi, I'm Shaime Gonzalez. I'm with the Office of Drug User Health here at New York State Department of Health.
Terrific. So glad to have everyone on this afternoon. Just in terms of kind of doing a level set, I feel like it's been a really long time since we've met, although I know it's only been a month. But just want to remind folks that this is an opportunity for us to kind of check in on the work that is underway using the opioid settlement funds to give insight into what's coming up, and then also provide an opportunity for folks to ask questions. I will also note that Chris Smith was unable to join us this afternoon, so typically Chris would be with us representing OMH, so we are without him, but if there are questions that are relevant to his agency, we'll certainly get questions to him and get answers for you. So having said that, very excited to talk about dollars made available to date. We have to this point, and I'll rely on Debbie to give information as needed around the regional abatement, but of the funding available, we have made 99% of the opioid settlement funds from fiscal year 2023 appropriations available. So we're really, really excited about that. We look forward to some additional opportunities coming in the next week and a half or so. And in terms of on the OASAS side, we do have actually three procurement opportunities that are open right now. Because they are open and we are in a blackout period, I will just say that we do have our non-medical transportation RFA that actually it closed yesterday. So we're eagerly awaiting news from our procurement folks in terms of how many applications we got and moving forward with scoring those. We also have our comprehensive outpatient integration round 2 RFA that is currently open, and applications are due August 29th, I believe. Hoping we're going to get a robust response on that as we move to greater integration of sites and availability of treatment in the OASAS system. And then finally, we did post last week our Research Institute RFP, and applications for that are due on 9/25. As with all of our procurements, you can go to the OASAS procurement page to read information about any of those opportunities, or also through the Opioid Settlement Fund information page on our website. I'm very happy to turn it over to, I don't know if it would be Joanne or Val, to also make mention of some recent opportunities that DOH has made available.
That's great. Thanks so much, Connie. So I'm going to go ahead and take the lead. Val is on, and certainly will add or edit anything that I offer. Hopefully you'll just have to add, Val. And I also just want to make note that this is the last meeting that I'll be attending, and Tina will be attending this meeting moving forward to provide all of you with updates. So we're also really excited about the fact that we too have dollars that are out the door and made public. And let me just walk through some of those funding opportunities that are now public. All right, give me 1 second. All right, so the first is actually a solicitation of interest. It is specific to the provision of harm reduction services via telemedicine. And just as Connie has said, while I can't offer a lot of information, what I would like to share is just a really brief summary of what this funding will support. It's an opportunity for a not-for-profit licensed medical practice to increase access to medications for addiction treatment or medications for opioid use disorder. So the entity would be responsible for providing low-threshold harm reduction services via telemedicine to persons with opioid use disorders or individuals who are at risk of overdose. And the purpose of the opportunity really is around expanding access, which is certainly something that we have heard a lot about. This solicitation of interest is in the amount of $1 million. Val, anything to add or edit on that?
That's
All
great.
right.
Thank you.
Okay, great. I'll keep moving forward. So the next request for applications that has been posted is expanding harm reduction services for priority populations who use drugs. Again, the State Department of Health, the AIDS Institute Office of Drug User Health has made available state funds to provide harm reduction interventions in community settings across New York State. The funding is directed specifically for persons who use drugs within priority populations that have shown evidence of being especially vulnerable to overdose and historically have been marginalized or stigmatized through different systems of care. So advancing health equity is an absolute expected outcome of this RFA and of the programs that would be awarded. And this is a total of $7.5 million over a period of 2 years. Anything for Val?
Nope, that's great. Thanks.
Okay. The third RFA is addressing drug overdose in New York State. And this is through the opioid, I want to clarify, stewardship funding.
Correct.
So again, there is an announcement of the availability of funds to implement interventions in community settings. These are settings or areas outside of New York City. The intention here is to prevent and respond to drug overdoses while utilizing harm reduction principles. And again, really looking at the essential need for us to advance health equity principles with the intention of reducing disparities. All right, Val hasn't jumped in, so I'm going to keep moving forward. And the last request for application that I want to announce is related to the development of a comprehensive coroner training program, and that's in New York State. This is the availability of state funds to develop a formal standardized training program for coroners in New York State with the goal to partner with eligible applicants across the state in order to develop a curriculum based on national standards and best practices, and then subsequently also the delivery of training. And that's in the amount of $400,000 over 2 years. So as I said before in the beginning, we're really excited that the opportunity has arrived for us to make these announcements, and we look forward to receiving applications as well as continuing to partner with many of you. Thank you.
Thanks, Joanne. So, so great. There's our update in terms of current opportunities. We do have a couple of other pieces that we wanted to mention, or at least be sure that folks were aware of. Before I do pivot to that, Debbie, is there anything else to add with regard to the regional abatement? I know we've been providing updates in terms of how much of the funding has been made available, and I think that we're close to 100% if we're not at 100%.
Yes, it keeps getting closer, so I will give you a quick update on that. So right now, out of the monies that were identified for local subdivisions, that includes our regional abatement dollars, dollars that go to 5 large cities, and then dollars that go to identified other litigating entities. The total amount would be $64,006,278. Out of that total amount, we've gotten out $63,448,504, which actually is 99%. So the process requires that you fill out a planned use of funds form, which is on our website. And then that gets provided to OASAS, and then we make the funding available. And so we're just waiting on a few other litigating entities to supply that. But otherwise, the 5 large cities, Albany, Buffalo, Rochester, Syracuse, and Yonkers, all paid. And then the 55 LGUs, all paid. So very exciting. And we're looking forward to getting that feedback on how the money is being used.
Awesome. Great. We're at 99%. We got to push that last 1% and close the door on these 2023 appropriations. I'm just also keeping an eye on the chat. And there was a question, could DOH provide information on where people can view the RFA opportunities that you mentioned?
Yeah, absolutely. I'll look to my colleagues and ask that we put that in the chat.
Awesome. Okay, great. That would be terrific. Thank you. All right. So, two, I'm glad to talk about the regional abatement because I do think it's really important for not only our provider communities, but for, you know, the broader, larger community to understand that in addition to the opportunities that OASAS and DOH are making available to our systems to address the opioid epidemic, that these regional dollars are going to county LGUs. OASAS is responsible for making those dollars available and passing them on to the counties, and then the counties are doing planning on how to use those dollars, of course in keeping with the Opioid Settlement Fund agreement, but just, you know, for everyone's awareness that there are additional opportunities you should be aware of and you know, asking questions in terms of what's happening with those dollars on the local level as well. And so speaking of which, I also, in terms of update, wanted to, if I'm gonna share my screen for a second. Things happen so quickly that I'm like, wait, have we shown this? Are you guys, have we shared this with the community? Are folks aware? So I know that folks are very aware of the opioid settlement funding initiatives page that we have on the OASAS website. I talk about it often. I encourage people to bookmark this page so they can find information readily in terms of the use of funds. I wanted to make folks aware of the fact that it is on this page that you'll get information on the Opioid Settlement Fund Tracker. Wait, what's that? Because this is new since our last meeting that OASAS has established this Opioid Settlement Fund Tracker, which I do want to show folks. There's also a link to our regional abatement information and, of course, information regarding the Opioid Settlement Fund Advisory Board. By the way, next meeting is scheduled for September 15th. So folks who are interested in viewing the live stream of the meeting know that you can go to our webpage to get access to that meeting. And again, the meeting is scheduled for September 15th. So I'm going to go ahead and share, and hopefully this works, right? And Debbie, give me a nod to make sure that you can see this. So we do have our Opioid Settlement Fund Tracker page that we published within the last few weeks. Happy to share information with the public and make them aware of how the dollars are being used and how much is being made available. So the first table that you see includes the priority areas and regional abatement. You'll also see there's the last line there for New York Matters because they had a separate $8 million allocation out of the OSF funding. But we have the amount that was allocated in each of those areas, and then also the amount that we have made available via procurement for each of those. So you'll see that we're very close. We're very close to being at 100%. And then also want to show folks that on this same page, you can get access to current open RFAs. I had mentioned all three of these earlier. And then further scroll down and you'll see that we actually have kind of a timeline of our funding opportunities that we made available. So we do have the date that the procurement was released and the initiative listed, the amount, and how many awards were issued as a result of that opportunity. If you click on the initiative name, it will take you to the RFA, so you can read about what that funding opportunity was. And if you click on the number of awards, you'll see the press release that includes the information in terms of who was awarded and how much each provider received. So an opportunity to get some additional information about who's receiving that funding for what effort. And we will continue to update this, and actually we'll be adding some additional information based on the RFAs that DOH recently released, I believe. We talked about making sure that we have everything available to folks. So happy to have this opportunity. We are updating it. So know that whatever is shown is live and current numbers. So we're really happy about that. I do want to go back and also show folks that with regard to the regional abatement, which we were talking about a minute ago, and I was encouraging folks to be aware of the dollars coming into your community. On the regional abatement page, we have information on the LGU and how much was made available to each LGU. So there's information by region and then by county in terms of funding made available. So you have a sense of how much money is going into the community. And then we also have just a quick bar graph here to show of those dollars we've made available, how has the county reported back to us that they intend to use those dollars? So this was, this was early on in the process when we made the funding available. We asked the LGUs, how they think they'll utilize the dollars based on the high priority categories. So we have a visual display to show. In this instance, for the Capital District, we're looking at $887,000 spent on prevention, harm reduction, $583, and so on. We do have similar information available for each region, and then again for each county. There's also a quick link to each of the county's websites, so that if you want to go to the website to see if they have additional funding opportunities or other information about the use of funds, that you can go to their website for that. So hoping to make as much information available to folks and helping them understand how we're managing the process and making those dollars available to folks across the state. So stay tuned, because I think we're working on building out some additional visuals to help people understand how those dollars are being used. And of course, as we go further into this process and get additional reporting and information and data on use of funds, we'll be able to provide that information, hopefully in an interesting way on our website as well. So having said that, Debbie, Lucia, is there anything else that we wanted to provide updates on that I have not mentioned? Debbie,
I think you covered it. Yeah, I think you covered it.
All right, great. And so thank you. Shaimei put in information about Grants Gateway and being able to access the DOH opportunities, so thank you for that. Let's see here, questions that we have coming in. So I'm seeing the chat just from the panel. So Lucia, do you want to manage questions in the chat?
Sure. I guess this question in the chat is likely for someone from DOH. I think they're referring to the mention of the telehealth RFA, but they're asking, is there an appropriate RFA to advance an evidence-based app for OUD patients in existing outpatient programs? Says the initial launch would be across academic medical center programs, Northwell and Stony Brook.
So, Val, I'm looking to you. I'm not sure if this is 100% for DOH, but I think if I understand the question correctly, it's whether or not any of the funding opportunities we described would fit what's being proposed. Am I right about that?
Nahal, if you want to take yourself off mute. Hold on. Someone
You might
just-
have to.
They can't unmute. Yeah. Well, I'm not seeing them in the list. I'm not sure if they hopped off after entering the question.
All right, so why don't we move on to the next question? And I am willing to do that at this point because all of the questions that are submitted, of course, we do post written responses to, and those go onto the opioid settlement funded page. So if we're unable to answer a question this afternoon, know that we will provide responses through that posting on our website.
Okay, Celine said they're unmuted, but
okay, so
You
why
should
don't
be
we
able
move
to
on?
speak, but let me know if you can't.
Yes,
I-
no.
yeah, we can hear
We
you.
can hear you.
Oh, okay, great. Sorry, I couldn't unmute myself before. I realize the question is a bit specific, but just wondering, if there's an appropriate RFA for this kind of addition to a program. So it's not really creating comprehensive treatment, but it's looking to add this to existing programs, specifically in Suffolk County.
Okay, so there's a part of me that is a little hesitant to respond directly, right? Because just because the RFAs are public now, and so I don't want to say anything that is not already detailed within the RFA. I think what I would encourage you to do though is to look at, one second. To look at, and this one isn't an RFA, this is a solicitation of interest, but to see whether or not what you're describing would align with the expectations of the provision of harm reduction services via telemedicine.
Got it. Okay, thank you.
Thank you.
Yeah, and Connie, I'm just going to throw out too, and it is always hard, but I feel like that question might have been not specific to a solicitation that we were actually talking about, but might have been just asking, is there some other solicitation that we know about within that county? And so, that type of update, is we're talking about specifically what comes through the state as part of in the OASAS as the lead state agency, having the appropriation in their budget that established the fund, the opioid settlement agreement fund, the fund. And those monies that come through the state are what we come together on a monthly basis to talk to you about updates on those solicitations. And then we're giving you specific links to where you can find those solicitations. But in general, let's say, the various counties, especially Nassau, Suffolk, and New York City, they received funding through the Attorney General, through the third-party administrator, and those funds are being planned for directly by those entities. And then there were additional funds sent out by that third-party administrator throughout the state, and we are not aware of what they're doing with those funds. So I think your best bet is to go to each county's kind of county page and see if there's anything related to opioid settlement fund, task force or procurements that are listed on their web pages, because this format that we're using to come together as a community is really only around the monies that come through the state. So that can be confusing. Totally agree, right? But hopefully that helps you a little bit, and we will try to be as informative as possible on certainly all of our procurements. And if we are knowledgeable of something else, we will definitely highlight that. Is that helpful? And does Connie or anyone else have anything to add?
No, that was helpful. I'm glad that you mentioned that. Nina, did you want to say something? I'm sorry.
No, I just wanted to say nothing to add. Thank you, Deb.
Other questions? Wow. I guess we answered them all. We're providing so much information at this point. There's no stone left unturned. That's great. I'll just hang on for just another second. If folks are contemplating a question, please feel free to enter that into the chat. As a reminder, we do have this meeting on a monthly basis, so be sure to tune in next time. Know that our the funding doesn't stop. We are only just getting started with our opioid settlement funding work that we are doing. As a reminder to folks, I do believe it was 16 years worth of funding that we will be receiving, and 2024 will put us actually in the third year of dollars made available. So know that we're all going to be getting together monthly for the next 13 years to talk about the work that we're doing. So I don't see any other questions coming up in the chat. Again, hope that these meetings are informative and helpful to folks. We're always here to answer your questions, of course, during the community meeting, as well as anything that you might want to send in through the Opioid Settlement Fund Project Management mailbox. And for procurements, whether posted through OASAS or DOH, there is information in terms of submitting questions or opportunities for the bidders conference type conversation about the RFAs or RFPs, or solicitations of interest. So please refer to those documents. If you can't find answers, then please reach out so we can get answers for you. Thanks, Lucia, for putting the OSF project management address in the chat. And if there is nothing further, I will thank everybody very much. Know that the very brief Q&A will be posted on the webpage within the next few days, and we'll be talking to you soon. So everybody take care. Bye-bye.